My name is Anne Marie Charlesworth, and I am the director of the UCSF Earth Center Community Engagement Corps. I and my co-chairs, Patrice Sutton, Robert Gould, and Nadia Gaber, would like to welcome you to Environmental Justice and Human Health, Creating Systemic Solutions, a 6-week mini medical school series co-organized by the UCSF Earth Center, the UCSF Program for Reproductive Health and the Environment, and San Francisco Bay Physicians for Social Responsibility, with further support by the UCSF Center for Climate Health and Equity and the Environmental and Climate Health Student Advisory Group. Tonight's session, Structural Racism and Environmental Justice in a World of Pandemics, will reflect on the devastating, disparate impacts of the COVID pandemic on communities of color and examine the role of structural racism in health outcomes and the systemic changes necessary to ensure health equity. Now, I'd like to introduce you to Patrice Sutton, who will moderate tonight's panel. Patrice is a research scientist who has worked with PRE since 2008 to advance evidence-based health protective action on environmental health science in clinical and policy arenas. Patrice has over 35 years of experience in occupational environmental health research, industrial hygiene, public health practice, policy development, and community-based advocacy. She is currently program co-chair of the San Francisco Bay Physicians for Social Responsibility's Environmental Health Committee. Now, I'd like to turn it over to Patrice Sutton.
Welcome. Hello, everyone, and thank you so much. I am so honored to be moderating tonight, and I just want to first begin this session by acknowledging that San Francisco Bay Physicians for Social Responsibility sits on the unceded ancestral homeland of the Ramaytush Ohlone peoples, who are the original inhabitants of the San Francisco Peninsula. And I also wanted to begin by just having a quote from Barbara Lee recently in the, when there was a new legislation recently put out by her, who, this is a quote from our local Congressman Barbara Lee, which said, "Inequality, systemic racism, and white supremacy are at the heart of every crisis we're facing now. The COVID-19 public health crisis disproportionately impacting communities of color, the crises of police brutality and mass incarceration, the crises of poverty, and much more." And I want to say tonight we have 3 speakers who are so well-versed to be commenting on these aspects of the pandemic. And I first want to begin by welcoming our first speaker, Michael Bird, who has over 25 years of public health experience in the areas of medical social work, healthcare administration, and public health policy. After growing up in New Mexico, California, and Utah, Michael received a bachelor's degree in anthropology and a master of social work from the University of Utah, and worked as a medical social worker for a number of years before gaining his master's in public health from UC Berkeley School of Public Health. Bird is the first American Indian and social worker to serve as president of the American Public Health Association, and he has been involved in numerous projects and programs on a local, tribal, national, and international level. Following his term at APHA, he served as executive director of the National Native American AIDS Prevention Center in Oakland. Bird is the first American Indian to serve on the National Policy Council for AARP, and he was recognized as one of the 75 most influential alumni by the University of California, Berkeley School of Public Health in 2018. So it's with really great privilege and honor that I will cede the floor to Michael. So thank you so much and welcome, Michael.
Well, thank you very much. I appreciate this opportunity to share some thoughts with you. I also, I feel like Congresswoman Barbara Lee's comments are right on target, and I think what I'll be sharing with you today really sort of elaborates on that history what I would say in titling my presentation, I don't have a PowerPoint, but I was thinking of a title. The appropriate title, from my perspective, would be "Old Roots, New Weeds," and from that, what I'm attempting to reflect really is the fact that for me, as an indigenous person, as a member of Kiowa Pueblo in New Mexico, you really have to, and as someone whose people have been here 10, 20, maybe 30,000 years, or as our traditional leaders would say, since time immemorial, what I think most indigenous people, most native people would approach anything like this really from a historical context. And what I attempt to do in much of my approach is really to look critically at the historical context in which we operate. And from that sense, you know, for some people, this new world, which was not new to anyone who'd been here 20 or 30,000 years, it was only new to those who were searching for actually India and ended up in the Americas. But what I think is really critical, and much of my thinking has been shaped not only in terms of my culture and my tradition, but really based on the work of Richard Drinan in a text, Facing West, The Metaphysics of Indian Hating and Empire Building, along with drawing on Dr. David Stannard, American Holocaust, and more recently, a wonderful book that I'm reading right now, titled The History of White People by Nell Painter, which is an incredible, it's an incredible piece of work in terms of an analysis of the history of this nation as it relates to primarily Anglo-Saxon Protestant population. The analysis that I utilize really is something unique happened when two worlds collided. When Europeans first set foot in the Americas, you know, the Spanish and French and the British, and these populations that set foot on what they termed a new world, you had two worlds that collided, and you had two populations and communities that came in contact. Obviously, the native population and the new those people new to this land, the Europeans. And what I have concluded really, and I think is part and parcel of where we are today, really is a reflection of that first contact. And for Europeans coming in contact with native people that you know, I believe it was the Catholic Church really that saw them as having no souls and not really even being human. The new people to the land defined native people as savage and non-human. They also defined nature as something that was wild and needed to be tamed. Also used the word savage and infinite. And out of that, I really believe that that has been sort of the basis and a framework which has been foundational to this nation. But also, when you define something, the flip side of that is you also define yourself. And so while the earth was defined as infinite and needing to be tamed, and native people were defined as savages and needing to be eliminated, the the natural world took on a definition. The people new to this land also, by the act of defining someone, defined themselves in the way that they related and saw those new elements to their world that they had never encountered before. And foundational to this nation's history is a history of genocide and theft of native land. Another element that I think is key to that was key to that experience and that foundational those foundational elements was in fact slavery and the enslavement of African Americans. And those two sort of planks in this nation's history have continued to play out, and we see that we see that very much so in our country today, and much of this history is clearly well documented, and it really has been in many cases really what we'd have to say, and from a Native perspective, has really been sort of a model that racism has been a major, racism has played a major role, and an exploitive model, not only of people, but also of the land and the environment, and not being cognizant of the fact that the world, in fact, is and nature and is in fact a living entity. All life comes from the earth. We are critically dependent upon clean air, clean land, clean water, and it's something that that I think there's been an alienation, that many people have been alienated from an understanding of the natural world and the importance and the critical aspect of balance and respect. And for Native people, that really has called into play that the earth, in fact, is our mother, and our mother gives us life and sustenance, and that if we're not respectful of, in fact, that relationship, we in fact end up in facing the circumstances in terms of environmental consequences that we are now and have been dealing with. I think that that the important this is being, I mean, much of this is being reflected in the reality of today. And I'll just share one quote from a recent report, Public Policy in the Trump Era, a Lancet Foundation report that just was published a month ago, in which Richard Horton, the editor of the Lancet, had this to say. He said, "The COVID pandemic has shown how woefully inadequate the country's healthcare and public health systems has been in protecting the nation's health." And he goes on to also say that, you know, that the US life expectancy has diminished 3.4 years in relation to the G7, the rest of the G7 nations. Well, what does this mean for marginalized and American Indian, African American, and Mexican American, and other marginalized communities? Well, if it has impacted the general population, when you look at our communities who in the case of American Indians, has the highest, pre-COVID, had the highest mortality and morbidity rates of any community, and a population that has a government to government relationship, not just a racial ethnic relationship, but a nation and a population that that has a government relationship, because we are citizens of our own tribes, of our own pueblos, and our own nations, when we in fact have had those conditions pre-pandemic. What does COVID now mean for us in the longer run? I think that there really needs to be, in the world today, we really need to have what other nations have engaged in, and that be it South Africa in their truth and reconciliation process, be it Canada and it's addressing issues of the Aboriginal First Nations, Native people of Canada, and a truth and reconciliation process really need to be, I think, looking at some sort of process that brings us together, that allows us to have a dialogue and conversation that has not taken place in this nation to this day. I would not limit that. I don't believe that it's limited to just Native populations. I think African American community and other communities of color who've been part of this American experience also need to have a role and be represented and be part of this conversation. I know that Congresswoman Barbara Lee has made remarks to that effect, as well as a number of other national leaders. But I think that until we really understand what it is we're dealing with in this legacy of racism and oppression and marginalization, we will really never really get beyond this point. And I believe that much of what we're dealing with are the consequences of those, I guess, that misunderstanding, that hate, and that anger, and that frustration. And we will really never, we're never gonna get out of this. When you're in a ditch, you really have to step back and say, well, how did we get here, and what is it we need to do to get out? And I guess I'll just at this point just close with one last quote, and that's by Stephen Hawking, the British astrophysicist. He said, "Intelligence is the ability to adapt to change." And I would tell you that if there's a population that knows anything about dealing with change in the past 500 years in the Americas, it is Native people, because we have dealt with every kind of imaginable change, both good and bad, that any people have on this planet. Thank you, and I appreciate your time and your attention, and look forward to the conversation.
Thank you so much, Michael. And I think that your title of Old Roots and New Weeds is really the perfect beginning for this conversation tonight, because the whole point of this whole series of webinars was really to look at more root causes and of these issues, and try to think about your points essentially about how do we get an honest accounting and a history told, and in order to move forward is, I think, exactly the right starting place. And so now I have the joy of introducing Judy Young, and Judy is Executive Director at the UCSF National Center of Excellence in Women's Health, and has over 30 years of experience in women's health in both academic institutions and community organizations. For over a decade, she has led UCSF's Young Women's Health and Leadership programs, where under her leadership, UCSF partnership with the San Francisco Unified School District and other community organizations deepened. And since then, over 3,500 young women have been inspired and expanded their vision of their own possibilities. That's an amazing accomplishment, Judy. She has been the co-chair of the UCSF Department of Obstetrics, Gynecology, and Reproductive Sciences Diversity Committee since its inception in 2013, and a valuable resource to faculty, staff, and learners. She was invited to be an inaugural member of the Executive Advisory Board of the Differences Matter Initiative of the School of Medicine. And for her contributions to UCSF and beyond, Judy has been recognized with the 2010 Chancellor's Award for the Advancement of Women and the 2017 Chancellor's Award, Martin Luther King Jr. Leadership Award. Thank you so much, Judy, for being with us tonight, and I will turn the floor over to you.
Thank you so much, Patrice, and thank you all for inviting me. Okay, well, I am delighted to be here to talk a little bit more about this work. And I really do appreciate Michael's introduction to us thinking about old roots, new weeds, and really the foundation you set for us about the history of this country and the long history of genocide and theft that this country's had, and the history of enslavement. The genocide and theft of from Native people, and the history of enslavement, and how that plays a role in what is happening now, how that is still happening, and that we need to be thinking about that, talking about that. And I think that the conversations around truth and reconciliation are much overdue. And so I appreciate you setting the context, Michael. And I think so there's threads through what I will be talking about as well. I wanted to just start off by the focus of my work that I've been doing has been focused on Black women. As the co-director of the Black Women's Health and Livelihood Initiative, a lot of the work that I focus on is around Black women's health. And I come to this conversation really from that point, and I just want to center myself and center you in how I show up in this work. I come to this conversation as a daughter, a wife, a sister, an auntie, a healer, a friend, a leader. And I bring my voice to this work, and I'm bringing the voice of many others who are no longer here. So on the screen, you see pictures of me and many of the people that I care about, and some of the people that I work with. And I just think it's important to just center myself into this work and to share with you that, because it's such an important piece. There's a little picture of me, of young Judy, down there in the corner. So, and that's really important to me, because it's not just it's the personal piece of the work that I bring to this, and it's the professional part of me that I bring to this. And so it's for my community, and it's as well as it's for myself that I do this work. At this time in our nation, and in the Bay Area, Black women continue to be the largest cohort of marginalized women whose lived experience is marred by poor health outcomes and interactions with healthcare institutions. Compared to white women, Black women are more likely to die in childbirth, to experience a lower likelihood of breast cancer diagnosis, but more likely to die from it, to experience higher rates of type 2 diabetes and heart disease, and to experience a lower overall life expectancy. And while it's a fact that access and poverty are large factors in healthcare disparities, and Black women are disproportionately poor in America, it's been shown over and over again in research that even when access and social economic status are the same, Black women still fare significantly worse than their white counterparts. This problem is not just about poverty or class. College-educated women have worse healthcare outcomes than white women who have just finished high school. I want to share with you a few stories. Shalon Irving, you'll see many of these pictures. I'm not going to share every story on this frame, but Shalon Irving, highly educated epidemiologist at the Centers for Disease Control and Prevention, died shortly after giving birth because her providers did not believe her, despite multiple visits over several days to a highly respected medical institution. Dr. Susan Moore died from COVID weeks after being discharged from the hospital, after doctors refused to adequately treat her pain and symptoms. Kira Johnson, a wealthy Black woman, daughter of a well-known TV personality and judge, bled to death just hours after giving birth at one of the premier hospitals in California, when no one would listen to her and her family when they stated she wasn't feeling well. Amber Rose Isaac raised concerns about her care and died in April 2020, 4 days after a cesarean section that went wrong. Henrietta Lacks, her cervical cells were taken from her for research against her consent while she was receiving treatment at a well-known institution. She died at age 31. While her cells are now known as the HeLa cells and are the most important cell lines in medical history and are still being used worldwide, neither she nor her family have benefited from this discovery. On this slide, you also see Sandra Bland, Breonna Taylor, and Erica Garner. These represent just some of the faces and some of the stories, and certainly not all. For many of these women, increased wealth and education were not protective, nor has it been protective for countless Black women like them. Black women are not listened to, and the consequences for us are not trivial. They are deadly. While the circumstances around these deaths of each of these women may be different, the actual underlying cause is the same: racism. Racism within our systems and institutions. And we're talking about health equity in the health system. Racism is within all of our systems and it's interconnected. Racism is a public health issue. Data collected about Black patient experience from various sources nationally, including surveys, focus groups, interviews, document themes, including racial stereotyping from providers, lack of respectful treatment, and coercion to select certain types of treatment. The COVID pandemic has done nothing but highlight those disparities and these types of treatment. In fact, it's made it worse. This type of treatment described is grounded in centuries-long systemic racism in healthcare and attempts to control Black people's care and, in fact, reproduction since 1619, the year that enslaved Africans were first brought to this country. I want to pivot and talk a little bit about solutions. And this is where the opportunity for truth and reconciliation that Michael talked about comes into play. The Black Women's Health and Livelihood Initiative, which I'm co-director of, was founded at UCSF to address health equity for Black women in our healthcare system. We envision a world where Black women are valued and nurtured the same way that Black women care for others. We prioritize and amplify the voice and power of Black women at UCSF and beyond to achieve their optimal health and well-being at home, at work, and in their communities. We do this by addressing health and wellness through all of these 6 pillars that you see here on your screen, through justice and equity, health and wellness, community building, leadership development, construction of knowledge and research, and education. We develop programs and resources and initiatives in all of these different key pillars. That's where our work is. Grounding our work are our core values. We center Black women. We partner with Black women. We demonstrate that Black women's lives matter. We engage with our community allies, and we're led by Black women. I'd like to share with you 2 specific examples of the way that we are working, 2 specific examples of our work, which we're working to achieve health equity within our systems, just to make it a little bit more concrete. One example is a project that we did in collaboration with many others, and it was the San Francisco Reproductive Justice Summit, Black Women Know. This was a collaboration between the San Francisco Department of Public Health, San Francisco Health Plan, Anthem Blue Cross, the San Francisco Unified School District, UCSF Preterm Birth Initiative, the UCSF National Center of Excellence in Women's Health, and the Black Women's Health and Livelihood Initiative. We worked for actually a couple of years to develop this summit focused on reproductive justice. And the goal was to challenge the prevalence of anti-Black racism within the San Francisco healthcare safety net system to develop actionable recommendations to improve racial equity and cultural responsiveness in the provision of care. Reproductive justice is a concept that was developed in 1994 by Black women in response to the reproductive rights movement's narrow focus on abortion access that excluded Black women and other people of color, low-income individuals, LGBTQ people, and other marginalized groups. This framework is grounded in human rights and it was defined as the right for all humans to maintain personal bodily autonomy, to have children, to choose not to have children, and to parent their children in safe and sustainable communities. So in doing this work, what was important to us was making the commitment to making Black women's voices heard and seen in all aspects of planning, especially in the content development of this summit. We made an intentional commitment to making sure community voices and youth voices were heard as well. So the participants were half community and youth and half providers. In order to make sure that we had fair exchange of knowledge and information and experience, we made that commitment to make sure it was an equal distribution of participants. And not only that, to make sure that community and youth could actually participate. Frequently when people are invited to come to a summit, providers can pay their way, or providers are it's considered part of their work. But community, it's not the same. So we made sure that we provided stipends for community to participate. This was a 3-day summit, 3 half days. So we provided stipends for community members to participate all 3 days, so that they were not losing money by taking time away from work, or if they needed to pay for childcare or other ways to be there, they were actually able to do that. So stipends were provided for all community members who were interested. The partnership with the San Francisco Unified School District allowed youth to be present without missing time from school. They were actually able to be there, and it was a commitment to them. It was an opportunity for them to be there as a part of their schoolwork. And that was another important way that they were engaged. The recommendations that come out of this work, we spent several days and several workshops making sure that we had recommendations. And so the recommendations are now being analyzed. We're in the process of getting that data. And the plan is to have a couple of pilots that come out of this that will be piloted at clinics locally. And then once we gather that experience and on all of the recommendations, we will be disseminating to our community members and to participants at the summit and to leadership at San Francisco Department of Public Health and to UCSF and to all of our stakeholders. The goal again is to provide recommendations on how we can make changes to dismantle some of the systems that have been harmful to community members. So we hope that through all of these kinds of conversations and prioritizing the voice of community and youth, that we will have learned what to do. We will pilot some of those recommendations, and we will learn how to do things differently, and we can make some changes within our systems. The second example that I want to share with you is one that we're currently working on, and that is the Black Women's Patient Family Advisory Council. For UCSF to be successful in its commitment to eliminating health disparities and anti-Black racism, it must create sustainable infrastructure that welcomes and engages and responds transparently to honest input of Black women advisors who can represent those most impacted by care inequities at UCSF and in healthcare more broadly. Our Patient Family Advisory Council will provide input to the UCSF and make sure that voices who haven't been heard will be heard. This will help reinforce transparency and rebuild trust among community builders, among the Black community and the health system. This again is another opportunity for that truth and reconciliation that Michael was talking about, where we can share information. We will develop systems of accountability between the advisory group and the administration, so we can talk about what those recommendations will do and how they will be carried forward. Community members will be paid for their time, and the power structure of the advisory group will be shared. So there will be a community member as the leader. There will be somebody representing the Black Women's Health and Livelihood Initiative, and then there will be a leader also from the UCSF health system. In that way, those recommendations will be more likely to be embedded into the health system. And so we hope that this is another way that we can demonstrate that we are listening to community members, we are investing in our community members, and that we are integrating ideas and thoughts back into the health system based on what community members are interested in. finally, with this idea, we also plan to provide health education to the community based on interest and desire. And so that's just a couple of examples of some of the work that we are doing at the Black Women's Health and Livelihood Initiative. We have other examples, but I will share that for Q&A or for other opportunities. And I just want to thank you for your time. I will close out here and leave opportunities for questions coming up. And I thank you for inviting me.
Thank you so much, Judy, for such an inspiring examples. And I do hope that we can hear more examples in the Q&A about also in terms of even, you mentioned among many things, the power structure and the sharing of the power structure. So that will be particularly interesting to hear more reflections about that, since it's so much about power. Thank you so much. And our next speaker is Dr. Rae Murray. And Dr. Murray has been a voice for social justice and health as a basic human right for over 50 years. And I just want to say, as a member of APHA, from the very first APHA meeting I ever went to, Dr. Murray was always there inspiring me. And so my vision of public health has been so framed by just having a yearly opportunity to hear Rae Murray speak. So I'm very indebted to Linda. She has spent her career serving the medically underserved. As a physician and public health professional, she has worked in a variety of settings, including practicing occupational medicine at a workers' clinic in Canada, residency director for occupational medicine at Meharry Medical College, bureau chief for the Chicago Department of Health under Mayor Harold Washington, and the medical director of a federally funded health center, Winfield Moody, which was served the Cabrini Green Public Housing Project in Chicago. Dr. Murray plays a leadership role in many organizations, including having served as president of the American Public Health Association. Dr. Murray has received many awards, including the Daniel Hale Williams Award from the Cook County Physicians Association and the Distinguished Service in the Health Field Award from the National Association of Minority Medical Educators. Since her retirement, that's kind of a laugh, Dr. Murray is devoting the rest of her career, as she puts it, to being an enthusiastic full-time troublemaker. So I will let Dr. Murray make good trouble for us tonight. Thank you so much.
Thank you, Pat. I'm so happy to be here tonight. I want to thank my sister Judy for really laying out some of the critical issues that we as Black women face. And I'm always honored to share a platform with my brother, Michael Bird. And in fact, I wasn't going to show slides, but he made me do it because he mentioned the book and he reminded me that that's an important thing that we need to do. So let me start off with Brother Malcolm. I want to concentrate, if I can, before we go into our discussion on what we mean by structural racism. For those of you that practice clinical medicine or are social workers or teachers that do any kind of thing that relate to individuals, this question, why are some people healthy and others not, is really the fundamental question that we face as practitioners when we're trying to do social change. We've had a land acknowledgement, but I wanted to stop on this slide for 1 second. The actual problems that we face when we steal land from indigenous people are with us today. This is the entire hemisphere. And so be very clear that the people that are being impacted by climate change, the underlying causes for immigration, people fleeing countries, is still going on because land is being stolen from our indigenous people on this hemisphere and around the world. This is what I wanted to make sure that I included some books. I'm going to recommend Roxanne's book. It is a high-level summary of indigenous history in the United States. It's simple, easy to read. And I also want to recommend Paul Ortiz's book that looks at African-American and Latinx history together, side by side. So what do we mean by racism? This is what Kamara Jones suggests would be good definitions. That racism is a hierarchical system that's designed to support white supremacy. It's a system that unfairly advantages some people and unfairly disadvantages others and saps the strength of the whole society. That unfairly advantaging some people are what Americans have trouble talking about. I want to remind us that anti-Black racism in the context of the world plays a critical role, but racism, as we've unfortunately seen last week in Atlanta. It's not a binary issue. It's not just blacks and whites. It's an issue. It's a hierarchy that includes everyone in the world. I also want to be clear that in my mind, the history of racism and capitalism cannot be separated. They grew up together. They're intimately intertwined. This is a quote, which I won't waste time reading to you, from Du Bois, really the finest social scientist of the past century, where he argues that racial capitalism is what allowed Europe to conquer the world and have the kind of economic success that they do possess. So we know in healthcare that health status is determined in large measure by class and by race, but they operate separately, as Judy pointed out, that Black women, for example, with college degrees fare worse often in health status than white high school dropouts. This is just a picture of Sister Jones. So when we talk about structural racism, I want to be clear, we're not talking about what language people are using. We're talking about a system that's baked into the country, baked in by history, baked in our whole policies. And when I think as a doctor about what makes people healthy, what causes that little black box on the right there, I think, yes, some of the intermediary factors are there. Do they have health insurance or not? Do they have a good doctor or not? Are the doctors and nurses listening to people? Can they get to healthcare? All these things are important, what we call the social determinants of health. But even underneath the social determinants of health are the structural determinants of health. How do we rank people? How do we allot resources? Do we pay attention to racism? Do we pay attention to gender discrimination and social class? Do we have a system that allows people to vote? In this country, we don't. Do we have an economic system that when there's a pandemic, people don't starve to death? Do we have a system that has guaranteed sick days? So these structural determinants are the profound drivers of the health of individuals and populations. And we also cannot talk about structure without talking about oppression and power. That's why George Floyd's murder resonated around the world, because people around the world, whether it's in Palestine or in Mexico, understand what oppression means and what power means. So let's look at structural racism. Take a second for a commercial. This is from the Legacy Museum in Montgomery and the Lynching Memorial. If you go through Alabama ever and you're sort of halfway near Montgomery, take a day and go there. So I show this to my younger students so that they have a clear notion of what history means. I just arbitrarily picked 1619. Actually, the first slaves were brought here in 15 something, but we won't worry about that right now. But you can see here, 61% of the time we've been on this continent, on this country, has been spent in slavery. And you can see the percent. So it's only a tiny percent, some 56 years since the Civil Rights Act of 1965. Let me put this in a better way where you can understand it. When I was a little girl, I met, and they held my hands, people who had been born in slavery. I'm 72 years old now. So I actually have touched the hands of people who were enslaved. That's something that my son and my granddaughters have never done. So slavery is really not that long ago, and it's important that we remember that. The other thing that's critical, that when we think about what's going on in this hemisphere and in the world, is that we understand this basic historical. This is a picture of the transatlantic slave trade. Only about 5% of all the people stolen from the continent of Africa that were enslaved ended up in the United States. That means 95% of them ended up in other parts of the hemisphere. So most people in the world who are African Americans, that is to say, who are from the Americas with slave ancestry, live outside the United States of America, and they speak Spanish and Portuguese. Nell Painter's book that Michael pointed out, but I will tell you this, when our last president was elected, I said, I have to go back and reread. I have to go back to basics. And so I went back and read Du Bois's Black Reconstruction. If you've never read it, you need to read it so you can really understand what happened January 6th and what's going on now. And you can't understand white supremacy and white people if you don't know their history. So reading Nell Painter's book is an excellent start. Let me give you an example of how insidious this problem is. This is Joshua Knott, a famous American a physician. He was pro-slavery, but he was really a renowned physician. You can see his comment about Negroes being subhuman. But this is a medical finding that existed in 1849 that was looking at reproductive problems that women have, reproductive problems of women, white women, and enslaved women. So you can see, and you can see both for miscarriages and other reproductive problems, the slave women did much worse. Now, this created a paradox because the notion was that Africans were meant to be slaves. We were subhuman. We thrived as slaves. It wasn't wrong or cruel to make us slaves. So this question comes up. Why do we see this difference in health outcomes? Is it because of the conditions of slavery? Or is it some constitutional, in other words, genetic or other factors for people who were enslaved? And this is what the article says. It's a great article if you can read it carefully today. And it basically says, is this problem we're having because in slavery, people have exposure to the elements, they have violent exercise, they have to do hard work, or some other reason? And then you can see in red their conclusion. So these scientists concluded that the reason there was this difference in outcomes is because of the unnatural tendency of the African female to destroy her offspring. This same dilemma exists today. That's what Sister Judy was talking about. Why is it that the birth outcomes of college graduate Black women is worse than high school dropouts? And when you ask people why, they always come back to some nonsense about conditions of African women, of Black women, as opposed to conditions of the society. So as Michael talked about, when we talk about immigration, we have to be honest and say what we really mean. We are a nation of immigrants, yes, but we're not a nation that's been nice to immigrants. This is just a map of the seizure by war of the top third or half of Mexico, and understanding that Texas was declared a republic because the Mexicans did not want slavery in Texas. They didn't mind having the white people come in there, but they said you can't have slaves. But you know, our folks, they believe in white supremacy and they brought slaves in. And here are some Mexican Americans lynched. And so this is an important history that we don't teach. Most Americans know a little bit about Black people being lynched, not as much as they should. But in fact, during the same period of history, when African Americans were lynched because of white supremacy and to keep control of us, Mexican Americans were being lynched in the South, in Texas and the Southwest at the same rates, in the same proportions. And other people were being lynched too. We'll get to that in a second. So that when you look at a picture like this, I don't know what you see. What I see is an echo of my history. I see young people fleeing terror. What do you think happened when 15-year-olds fled from Mississippi to Chicago or Cleveland or Pittsburgh, fleeing terror? The same thing that we see here fleeing across our southern border. So, and we shouldn't forget that one of the largest human migrations from terror was the migration of some 6 million, conservatively, Black people out of the Confederacy, out of the old Confederacy. Here in the upper right, the largest mass lynching that existed in the United States of America. Let me say this again clearly. The largest mass lynching that has existed in our nation's history was in 1871, when 500 white men stormed into a Chinese immigrant community and lynched at least 20 Chinese men and boys, and also killed and robbed many others. So this happened before the Chinese Exclusion Act, which was in 1882. This is a country whose first act of law was to say that you could only be a naturalized citizen for the United States if you were a white man free. So this is not a country that's welcomed immigrants. We shouldn't forget the internment of Japanese Americans in concentration camps on the West Coast. I'd like to point out that in Hawaii, where a third of the population is of Japanese ancestry, less than 2,000 were interred during World War II. That's what happens when you have power. And so now this is a big deal because of Atlanta, but this should not be a surprise. There's always been anti-Asian racism in this country, and it's morphed depending on what time period and what group you're talking about. And you can see the unfavorable attitude toward Asians on this graph. So right now they are the largest immigrant group. And so we should pay attention to it. And we should remember that all the way, actually till today, a basic right of citizenship, the right to vote, has not been entrenched in our history. It's not until 1879 that the courts declared Native Americans human. In the 1800s, Chinese were not allowed to testify in court against white people because they weren't considered human enough to dare to come in and say anything about a white person. You can see it's really not until the 20s, actually even after this, that Native Americans were allowed to vote. Not till the 50s that people with Asian ancestry had the right to become citizens. And of course, even though we had a major victory in 1965 with the Voting Rights Act, we've certainly had major voter suppression since then. So we are a country that has not fully recognized the basic civil rights and rights of citizens for most people in this country. Again, if we think about what's going on and why people are healthy or not, this is looking at wealth. And I just want to point out that white people without a college degree have more wealth than either Blacks or Latinx. Native Americans aren't on this picture, but I could put them on here. So what are we saying when you talk about racism? It's a real problem. This is looking at COVID deaths. And you can see that I don't care how you do the data, Black and Native American are always there, 1 and 2. But even here, you have to be careful. For example, in the Bay Area, especially some of the early data, some of the highest death rates from COVID were among Asians. So you have to be careful when you look at national data and think carefully. Here's another view of how more likely these groups are to die than white Americans. And again, looking at cases and deaths. So when we talk about structural racism, it's a real thing. You don't have to consciously be aware of the fact that you're going into Asian spas and shooting Asian women. You can pretend that you're going there for some other reason. That's what we mean by structural racism. It's baked in. It's like the racism operates whether you consciously are aware of it or not. I consider it like a mold. If you make a cake batter and your mold is a mold of a sheet cake, that's the way the cake comes out. If your mold is a butt cake, your cake comes out that way. So with structural racism, it's the mold that our society makes that determines what kind of education people get, what kind of water rights they get, what kind of ability to vote that they get. And it's that process of creating those racist structures based on white supremacy that determines people's health. So when the pandemic first started, people were worried about these death rates, and they immediately went to these normal things that we go to: hypertension, diabetes, obesity. I'm a physician. It's not that these things are not important in terms of whether one is likely to have trouble with COVID or other kinds of secondary diseases. But this is what is really going on with COVID that's clear now. It's structural racism. Who has to work face-to-face with the public and who gets to work remote? Who has to take public transportation to work and who has a car or stays home remote? Who's incarcerated, whether you're incarcerated in a local jail or a federal jail or an ICE detention home, and who stays home? Who is in nursing homes and poor quality nursing homes that are understaffed? Who's forced to work in essential low-paid jobs? Who is more likely to be unhoused? So when you look at these structural factors for who is contracting and dying from COVID, we see these factors are more important even than the individual factors that may exist. And I always think of this cartoon, because on one hand, it says you're going to work in unsafe conditions. We're not going to give you PPE. We're not going to give you a mask. And if you refuse to work, we're going to starve you to death and not pay you at all. So this is a strange country where the reality is people didn't have a choice but to go to work. I'll look at these later. So when we think about communities that have been hard hit by COVID, these are the same communities that have bad air quality, that have trouble walking, with parks that have bad housing stock, that have food deserts. These same problems are here. This is just a look at how people are that were incarcerated. The other thing I want to say, this is important. No one should be surprised that people of color don't trust white folks. But that is not the reason or explanation, not the whole explanation of why we see differences in vaccine uptake. This is Kaiser. They've been following this for some time. And you can see here that the people who definitely will not get COVID for this particular time period was the same for Blacks and whites. Actually, the group that's the most vaccine hesitant have been white male Republicans. So when we ask ourselves, what can we do to get people vaccinated? We know populations are moving and more willing to get vaccinated, but you still have to have it done in an equitable fashion, and we haven't seen that. So we have a problem in this country and a problem in the world. We are in a country that does not have a good public health system. Less than a third of our public health systems even have an epidemiologist on staff. When we look at the impact of COVID, the race and ethnicity data, and certainly our class data is often missing. We have not had a good surveillance system to keep track of this. We are not doing what we need to do. And we're trying to vaccinate all Americans, and we're refusing to vaccinate the global South, which will come back to bite us. So we have some solutions. Again, I'm not going to read through all of these. I think the solutions are pretty clear. We have to pay attention to all these stages of life. What are we doing in early stages of life? Do we make sure our kids don't starve? We're talking about a care package that lifts half the children out of poverty. We should be asking ourselves, why do we have any children living in poverty in this, the richest country in the land? Why do we have people going in debt to get an education? What kind of employment and working conditions do we fight for? Do we make sure that people are paid what they deserve to be paid? And by the way, $15 an hour is not enough. It's not a living wage. What are we doing about housing? We should have no one unhoused. And what are we doing about racism? This is not a question of kumbaya moments. I'm not against that. I'm not against truth and reconciliation, but you got to have truth before you can have reconciliation. And I will be remiss if I didn't say this. In the first 100 days, I know this is not going to happen, but it could happen. In the first 100 days, our president should have been putting in Medicare for all if we're really going to tackle this pandemic. So let me just stop here and say what we should be doing. We need to pay attention to all of these issues, all of us. We need to learn our history and other people's history. We need to talk about racism clearly, and we need to understand it in all of its nuances. So then you won't be, there's not a Black person in this country that's surprised that Asian women get murdered. There might be some white people that are surprised, but there's not any Black person or Puerto Rican person or Mexican person. We have to understand where racism is present. That's easy, it's present everywhere. How exactly is it operating? Because if you don't know how exactly it's operating, you can't stop it, you can't dismantle it. We have to understand the systems, and we have to be good at deciphering the structures that perpetuate white supremacy and oppression. This is one of my favorite quotes from King, and it's an homage to Breonna Taylor. Rarely do we find men who are willing to engage in hard, solid thinking. There's an almost universal quest for easy answers and half-baked solutions. Nothing pains some people more than having to think. Here's some other great books that people ought to be reading about health and healthcare in our country. And I'll make sure that these slides get sent to the organizers so you all can get them at a later date and check out some of these great books. So the challenges we face as Americans are the same challenges we face in the world, and the root causes of the problem are the same. Capitalism that is destroying the planet, climate change that is going to increase people fleeing and migrating all over the world and threaten their livelihood and their ability to stay alive. Climate change that continues to produce pandemics. We will have another coronavirus pandemic. It'll be another virus. And if we aren't aware of these problems and we don't begin to address the underlying causes, then we'll be here having these same conversations in 10, 15, or 20 years.
Thank you so much, Linda. That is a great call to action. And I wanted to invite Michael and Judy to come back for the Q&A. Well, we've gotten to some roots, and I wanted to just start to ask, given what all the amazing history and examples you've given us, so how do we go about an honest accounting and an honest history? Because it's kind of a line that goes through everyone's talks in terms of needing this. So I was just going to mention, it's been kind of alluded to, and Michael mentioned it, but last month, Representative Barbara Lee and Senator Cory Booker reintroduced the legislation to form a Truth, Racial Hearing and Transformation Commission to create a means to have the urgent unmet need for basically an honest history and an honest accounting. And the commission will examine the effects of slavery, institutional racism, and discrimination against people of color, and how our history impacts laws and policies today. So I just wanted to open it up to you all to ask basically, what are your thoughts for truth, reconciliation, and reparations ultimately?
Well, we've done this before. We haven't done the kind of global national effort that's, for example, South Africa did, but I can name some things. You know, we had in my lifetime the Kerner Commission. If you actually read the Kerner Commission, it was quite eloquent. It said we have two countries that are apart, and if we don't stop discriminating against Black people, these problems will continue. We have had commissions locally around Tulsa, Oklahoma, in Chicago in 1919 and 1920, when there were riots of white people coming into the Black community, killing people. There were commissions then that, again, were very clear and very eloquent in terms of why it existed and what happened. So I think you have to have truth. I understand that, but you can't really have reconciliation without addressing the structure. So can we have reconciliation if we don't get rid of the Electoral College? I don't think so. Okay, that's basically an undemocratic structure that was put up there to prop up white supremacy. So how can we have reconciliation if we're not willing to get rid of that? How can we have reconciliation if we're not willing to say that people who work every day shouldn't be living in poverty? You know, if you're working what we consider a full-time job, how do we allow that person to make poverty wages? And so I think there has to be a fundamental desire to dismantle racism and dismantle oppression, and then assemble and build different kinds of structures with different kinds of values. And so truth and reconciliation is not enough for me.
Judy, Michael, do you have comments on that?
It's Michael. I'd say just give me my country back and we'll call it even.
Is Deb Holland going to be doing?
And I don't want to get Deb in trouble. She's got more than a full plate already to deal with. You know, I think somehow we really need some moral leadership. I guess two things come to mind. One is the bottom line is that we live in a nation where people value things more than they do people. And in my grandfather's words, he would say, been long gone, but he would say this nation values the God Almighty dollar. And again, that reflects the fact that there are people in this country who value things more than people. And until we get to the point where we have a conversation, a moral conversation, not just a political, it's got to be a conversation on a number of levels. But I think without some sort of moral basis for the conversation as to who are we, what are we, and what do we really value, and what kind of nation and world do we wish to live in? Because other countries have already, the point was made. There are other countries who have made different choices and have different economic systems that appear to be more equitable, more fair, and their citizens are more content and happier and better better off than we are in this country, which we like to think, well, you know, we're number one and all this sort of rah-rah stuff, which doesn't hold water.
Thank you. Judy?
Yeah, I agree with everything that's been said. I think the parts I would just emphasize is that, you know, to have truth and reconciliation, we all have to tell the truth. So many of us have been telling the truth, but not all of us have been telling the truth. And so people have to understand the truth, learn the history, and then actually work toward it. And I think Michael's point about focusing and grounding us in relationships and focusing on that gets us to that reconciliation point, and people have to desire that, and that hasn't been true. So people aren't actually speaking the truth, and some people don't even know the truth. They're denying the truth. So I think that's a big piece of it. And other than that, I agree with everything else that's been said. I don't want to re-emphasize it. There's a lot of work to be done.
Yeah, you know, Judy, one thing that struck me, because you mentioned the Black Women's Patient Family and Advisory Commission, that it's honest input from Black women. And it really struck me because I thought it's really the honest part needs to come probably from the other side, you know, in the sense of just the idea of that the wording that you used, I just thought was really interesting in terms of the fundamental aspect of honesty being needed to even begin to start the conversation. I see some questions here. So this one is to Judy. So it is regarding the years it took to organize the Reproductive Justice Summit. What are the high-level barriers you faced in organizing the summit, especially with different, oh, sorry, this is a problem of glasses, especially with different partners in varying places of power. So the San Francisco Department of Public Health, yes. And what were some strategies that worked?
That's a great question. It did take us a couple of years to actually get this summit off the ground. And some of the delays were COVID-related delays. It started off being an in-person summit, and we ended up turning it completely virtual. I will say that the commitment from all of the partners was strong. So I think that we started off with people who were working in partnership and had collaborated before. So many of us who were working together had collaborated. Many of us individuals and organizations had collaborated before in different ways. And so I think we started off with a strong desire to put together this summit, and had organizational support from all levels of our organization to say this is an important issue that we needed to do. So I think the desire was there from the very beginning, and there was some commitment for some resources to do this. And I think that so I think in terms of barriers that we faced, you know, initially we started off very strong. I think that the challenges that sort of evolved as you go through it, as I sort of read the definition of reproductive justice, you know, reproductive justice, because it was framed and started as a concept around this making sure we have rights around our health, and especially because it was a concept that was founded by Black women, because we were specifically left out. Our voices were not heard. This was about making sure Black women were at the table, and other people who had been marginalized were at the table, and that people had autonomy around their voices, especially because the reproductive movement was founded on the research that was done on Indigenous and Black women, right? So we know that the gynecology and obstetrics was founded on research that was done on Indigenous and enslaved women. And so being able to have Black women at the table doing this work, I think that was probably the biggest challenge. So it really wasn't a high-level barrier. It was more of a barrier, and I don't want to say barrier, but more of a point of conversation with this very diverse committee about how do we think about making sure Black women were the ones leading this conversation, and Black women were the ones developing the content. When there were other people who wanted to be very, very engaged in the content planning. And so when you normally think about a conference or a summit, you have very, very diverse perspectives in content planning. And we had to have very, very deep conversations about how do we really think about this content planning, and what is the purpose of this, and how do we center this so that Black women's voices are heard centered in this conversation in the planning. And so that I think was I won't say a barrier, but I think it was a point of a pivoting point to understand that needed to be centered, and that was critical. And once we got to there, then other things sort of opened up. I think the barriers, sort of more the logistical barriers, became making sure that you have the right people attending. And how do you do that with something that was constantly moving, with COVID happening, so and the political barriers. We wanted to make sure that we had the right people attending. So bringing community members, which was, that thing about making sure we paid for community members. We applied for grants. So we were funded through a grant to make sure we had resources for community members to attend. And then making sure providers had time away from their jobs to come, and getting providers' schedules cleared with enough time so that they could actually show up, so that their voices could be in the mix. And so that was logistically challenging, I would say. And I think those were the barriers, because those are the voices that you needed to have at the table, and the youth voices were important too. And so the school district helped with that a lot. So I would say that was not as big of a barrier, but I think those are logistical things that made it challenging. But they were so important. The really key was making sure that enough of the right people were there so that the conversations could be rich enough and deep enough. And that was our commitment, was to not put something on where it just had providers or it just had certain types of people. We wanted to make sure that every conversation had as many mixtures of people, so that it was rich, and the conversations at the actual summit had a balance. And fortunately, the organizing once we got our group organized, some of those logistics started to clear up. We just kept ourselves centered with our goal and our mission, and that really helped.
I see. Oh wait, hold on. There's a question about, and I see Ann Salinas, I see your question, but I thought it might be a good one to have more at the end. In addition to Medicare for all, it seems that we also need guaranteed jobs for all. Any comments?
Absolutely, we need to deconstruct our economy. There are so many things in the world, including in this country, that need to be done. It's not that we lack work that needs to be done. We lack a will to pay and compensate for that work. But let me be clear, while we're waiting for good jobs, I believe in guaranteed income. I'm 72. I remember when I was young that Black women on welfare were calling for guaranteed income. So that's what we need. Those are just some of the beginning. But fundamentally, I want to be clear, because we've won victories before and have lost ground on that, like we see now with voter suppression. We have to secure our democracy. In my mind, the two most critical things are the ability to learn. I don't just mean the ability to go to school and get a degree, that's important, but the ability to learn your history, your truth, to talk to people, and the ability to secure democracy. And so this is something that we don't have in the United States. We are unable to secure our democracy, and it's not just because of January 6th, though that is just one example of it. And without that, we can't secure any other kind of programs. Every time we've made progress, ending chattel slavery, Black men getting the right to vote, how long did that last? Okay, and today we have less of a right to vote than we did in the immediate aftermath of the Civil War. So yes, we need good jobs. We really need to come together and secure control of our country, and address the history and right the historic wrongs that have been perpetrated by a small group of people.
Michael, did you have a comment on that?
I think what I wanted to pick up on was, that there, in terms of, I saw one of the questions, and in terms of what gives me hope, I think, if we can't learn from what we're experiencing now, not just communities of color, but if the general populace can't learn, given the COVID pandemic, given the the rise of white supremacy, given all of this, if there are not enough people in this country to recognize that, to own it, and to mobilize around this, I'm not sure what can really change things. And we will end up losing what we have, and it's not just going to be, the bottom line, it's not just going to be people of color who are losing. This nation will lose. We will lose the foundation. As inadequate as it is what we have, and it is what has inspired and brought hope to people, and we will lose that. And I just hope, that the younger generation, and I think there is hope for the younger generation. Some of them are not caught up have not bought the farm, have not been totally corrupted in terms of their thinking, and they seem to be motivated and invigorated and recognize that their lives, their future, given global warming and given decisions that have been made in the past by the powerful and the privileged, do not serve them and do not serve any of us well.
Thank you. Judy, did you want to comment on any of that?
I was thinking about this comment about what gives me hope, and it's a mixture. Michael, I was reflecting on what you just said about some of the younger generation. Some of them do give me a lot of hope, but I think I am also just encouraged when I see us working, just across our differences, and when I see us just aligning, as my sister Linda Rae, when she was sharing in her slides about all of the different, all of our different communities that have been challenged, have had all of the oppression that's happened to all of us. And when we start to we're working together, and when our communities are working together, that always gives me hope when I see us working together as opposed to trying to silo ourselves. And so, not feeling like I'm saying it as well as I want to, but I think I feel hope and power when I feel like we're working together and not trying to compete based on this oppression Olympics that some people try to pull. I always feel more hopeful when we're doing this together, when we're in this conversation together, when we're working to sort of say, how do we work together and pull ourselves, support each other in a different way.
So Michael and Judy addressed the question that was in it. So maybe I will give Linda the last word about what gives you hope today.
Well, I think that history gives me hope. They tried to exterminate indigenous people on the hemisphere, and they failed. They're still here. They tried to grind people that were enslaved into the earth, and we're still here. So they tried to really destroy us as subhumans, and we survive, and we continue to fight and resist. So yes, young people give me hope, but young people are always young, and they always rise up to resist. We have a lot of challenges that we didn't have before. It's not the same struggle. It's a much more difficult struggle. I think climate change is a existential threat to the planet, or at least to the human species of the planet. But I am hopeful because we've survived this long and because we continue to resist. And to the extent that we not only don't work in silos, but to the extent that we understand the common root, the common structural root, if you will, of our oppression and our pain and our suffering, to that extent that we have some hope of dismantling that cause of our pain and suffering.
Thank you. Well, I wanted to also just, before we end, just see if there's anything that has not been said that you want to leave folks with, just to give you all an opportunity to have any other words you just were give people so much to reflect on, and we're so appreciative to bring this content to the viewers. And I know that folks who are on can also know that all of this content will be available on YouTube and UCTV afterwards, so you can get the word out so that many others can hear these amazing presentations. So before I turn it over to Anne Marie, Judy, or Linda, or Michael, is there any last words you want to leave us with?
Yeah, Patrice, this is Michael, and having obviously an investment in the Bay Area going back a number of years, I just wanted to just mention something that's occurring right now that really cuts across all of the conversation we're having now, and that is at Point Reyes National Seashore Park. The National Park Service is in the process of reviewing and possibly adopting an amendment to the general management plan that they have that would allow continued and expanded ranching activities at the National Seashore Park. And one of the things, just as a point of reference, is that in fact this is Miwok originally ancestral Miwok territory, and there's some significant plans that are being proposed that cuts across public health, that cuts across access of communities of color, and I think there's there's a need for those of us who are concerned about these issues to begin to pay attention to that topic and that issue. So I'm just going to mention that, be happy to share information at some point in the future.
Thank you. And you could, because we have an opportunity to, if there's other resources like that we can put up on the website at UCSF as part of this series. So we'd be delighted to share that as that unfolds.
And good public health is protect the land and protect the people.
You know, you just from your presentation, the idea that people could think those are separate is, yeah. Thank you so much. Judy or Linda, anything that you want to add before we close?
When we fight, we have a chance of winning. So it just means people have to go back and fight for what you believe in.
Thank you. That's great.
I agree. Just lift up everything that's been said.
Yeah.
I appreciate it. Lift up all that's been said. Stay in relationship.
Yes.
You have to stay in relationship.
With people and the land.
With people and the land. That's right.
And with that, I will once again thank you all so much. And especially I want to acknowledge Linda. It's very late where you are. So thank you for staying up to be with us. And I'm going to turn it back over to Anne Marie. And I know there's like rave reviews here in the chat. So thank you all so much. And Anne Marie will bring us home.
Yes. Wow. Thank you so much. Michael, Linda, Rae, Judy, this was a really, it was an incredible session. So thank you. I feel like this really began an important conversation together that I'm really hoping will continue after tonight. As Patrice mentioned, this whole session will be taped and made available through UCTV and YouTube. We're happy to post additional resources, on our websites. So with that, and mindful of the time, I'd like to encourage everyone to stay in touch. If you have additional questions, please reach out to us, to our wonderful, to our inspiring colleagues who've been so generous with their time and sharing their hopes, their vision, their experience, and we will help facilitate you get connected. Thank you, everyone.